I'm here at the University of Luxembourg's Lunar Lab to talk about nothing to do with the moon, but anesthetics and how artificial intelligence can meet this very important part of healthcare. I'm here with Ghada Othman to talk more about this, and she's going to tell me more about her technology. Great to meet you.
Thank you very much.
Thank you so much for being here. So tell me, how does AI meet anesthetics? What's the connection?
So we are here using AI to make the surgery environment less demanding for the anesthesiologist and less also critical for the patient. We are using artificial intelligence to help control closed-loop control systems, to manage, control and optimize the dosage of the drugs, to have the best awareness in pain levels.
Well, AI is such a trending concept, but you're combining it with something quite unusual.
Yes, AI have been used in medical field, which is my field, for now like more than 20 years, 30 years. So it's really not that trend in the field itself, but in general, we have AI now for 70 years. We see every day something new in it. That's why it's still trending. So to start maybe from the beginning to make it clear for everyone, during the surgery room, we know the patient needs to be anesthetized. We use some drugs, for example, like propofol, remifentanil. I think those are the most famous drugs. And the anesthesiologist during the surgery needs to keep an eye on the for example, how far this patient is now anesthetized.
Which gets me thinking that a lot of data is being collected.
Yes.
Which is exactly what AI loves, data.
Yes, indeed. Here, what we are trying to do is to make a closed control system, closed loop, in which we have the data from the patient. For example, we have the BIS index, which is an index goes from 0 to 100. If it's 100, then the patient is totally aware. If it's 0, then it's resting in peace, let's say. So those data that we take to control the dosage of the drugs that we give to the patient. So we are now helping the anesthesiologist to keep the patient safe during the surgery, and also it helps after the surgery and like the readmission of the patient. Also, we save here money because we're saving amount of the propofol and remifentanil when we give the exact optimal dosage of the drugs.
You know, when anyone is working with AI, there's always this assumption that you know how to code, you are like a computer software engineer.
Yes.
So you combining AI with something in healthcare, is that assumption wrong? I mean, are you a coder, basically?
No, I am a coder, but in these kind of fields, it needs to be a data analyst too.
How did you personally get to this point where you are combining so many different disciplines into one?
System engineering, it's my background, but I was like more caring about artificial intelligence. That was I like to do, let's say. So I focused on it after finishing my 5 years of engineering. So then I decided to continue on it.
Many people think that AI is replacing people's jobs.
Our project, it is not the case. We are working just to help the anesthesiologist, or maybe in the heart placement, the electrode placement, just to make the surgery room for the doctors less crowded, but it's not to replace.
I just want to flag up that we see a fellow engineer here who does not fit the stereotype of what people imagine engineers to look like. So congratulations, I think it's really important to point that out. What's the future of your technology and what you're developing?
Research is something that you need to innovate yourself. You need yourself to bring questions and then to reply to these questions.
You're also not 100% at the University of Luxembourg where we are today.
Yeah, I follow like a co-diploma program. This project is mainly started from Ghent University. I extracted the data in Ghent Hospital. So here I have another project which is in the medical field. Also, the aim of the other project is we are working on the electrocardiogram signals that we get from the heart. These signals give us an idea how electrically the heart now is acting, the activity of the heart. So the idea here, as we have many sensors in one same area, is to reduce this. Instead of using, for example, 5 sites, we use 3, and we use artificial intelligence to predict the others. So we make this area less crowded. And also we use artificial intelligence in case of any sensor failure.
I mean, it's going to change people's experiences of surgery, hospitals, healthcare.
Actually, it's my biggest motivation for my work. That's why I see it may come with a very good impact. It makes you feel good to be aware that you can make a plus in this field.